Good morning, everyone, and thank you for inviting me to talk in future surgery. I'm very excited to share our experience with all the audience. My name is Rafael Guerrero. I'm the head of congenital cardiac surgery in Alderhay Children's Hospital in the northwest of the country. I'm director of the Heart Center and director of healthcare innovation. We founded about 5 years ago. So I choose as a topic, the best accelerator is a crisis. And you probably can guess why I choose this title. But there is so many amazing speakers in this meeting, and I'm going to concentrate to speak about immersive technology in healthcare. COVID-19 pandemic, it pushed us to develop a bit of cardiac innovation, and mainly how we are going to deliver the service for a life-threatening condition in which many babies are born, need to be treated immediately, otherwise they will not be able to survive. And I've been involved with the use of technology for some time as part of my probably hobby. And in this point, I'm going to talk about immersive tech, but more importantly, it's about the vision. It's not so much about the technology itself, but what I think that it will look like in the future and how can we use this technology to help human beings. In Alderhay Heart Center, we cover a population of about 8 million people for the northwest of England, including the Isle of Man, north part of Wales. And we needed really to have a strategic proactive plan to see how we were going to carry on providing the service during the pandemic. And we started as early as a beginning of the end of March, when we knew that this was a big problem. We are only 3 consultants providing this service in the whole area. And in the middle of the night, or at 3 o'clock in the morning, bulb lights, it came my idea why we don't develop some kind of teams and like tours. And this is my drawing with bits of coffee on the paper, showing we develop what we call the designated survival rota, in which we create 3 teams, which included surgeon, cardiologists, intervention cardiologists, specialist nurses, anesthetists, scrub nurses for theater. And we developed a way in which one team was working for 7 days and the next team were on standby at home waiting for if anything was getting ill or needed to go home if they were infected, meaning the professionals. And that way we're trying to keep a resilient rota and provide the service. The outcomes were amazing. And this is just to show that innovation is not just about technology, but innovation is about innovating about the processes to keep with a pandemic. And we managed to keep uninterrupted cardiac service in the area. Not just only that, we, as a chairman of the Congenital National Society, we got in touch with all the units in the country, which are 9 units, and we all developed similar processes. And we have team sickness, nobody was sick, or no member of the team were sick. No patient acquired COVID-19 in our group. We carry on with telehealth, supporting the big network that we have to cover in a huge geographic area. And our activity remained about 80% or sometimes more than that in a very risk stratified area. And we occupy more than 90% of the beds in intensive care. And this is just to show you that innovation means not just technology, but processes and how you can think in many changes and adapt to the crisis. And that's what I mean, the best accelerator is that. If you want to try to do that in a normal day, to trying to work for 7 days, you will have a lot of resistance. We have tremendous outcomes. We have a baby, a newborn baby, probably one of the few or only in the world who born with a horrendous anatomical malformation of the heart, which they needed to be operated in the first few days of life, otherwise they will not survive. And I operate him with, after putting on ECMO machine and then doing the correction of the heart. And then he did really well and did make the news because it's a unique case. And our surgical mortality during the first 6 months of the year remained 0%, which was thanks to a tremendous work from the whole team. Of course, and this paper is probably for around May or June, where they were talking about second waves, and we are not just in a wave, we're probably in a tsunami at the moment. And there was no doubt that we needed to be prepared for that. We went from the R number to a P number. R number, we all know, which is the reproduction. So one person passed to the next person. And we wanted to be proactive and say, how can we protect my colleagues so my colleagues can protect their family and so on. And we came with the idea of a P number instead of an R number. And this all show you that, you start thinking very rapidly, not just us, but so many thousands of healthcare professionals, and not just health professionals, but in general, around the world to see how can they manage during these times. Specifically for a health center where or a hospital where we needed to reduce is the use of PPE. We all know how there was not enough PPEs. We needed to prevent cross-infection. We needed to continue having interactive work rounds and absolutely patient-centered real-time information. And we came across, I've been working with the immersive technology for a few years, and this is being evolving in a gradual way. And it just happened to be that at this time, over the last 6 months or 9 months, there were a few changes specifically in the HoloLens produced by Microsoft, in which they brought to the next level. And when you copy from other industries, and that's where you need to look for innovation, looking at what other industries are doing, like the nuclear industry or the oil industry or the automotive industry. And sometimes that's where you find the ideas to adapt new technologies to healthcare. And that was the way that it came to me. And as a background, Alderhay, as I mentioned before, is a huge hospital. It's one of the largest in Europe and covers a large area. It's a beautiful modern hospital. And the challenge that we have is we really needed to keep caring for the children and carry on undertaking work rounds, consult medical colleagues. There was a significant number of colleagues and nurses who were isolated because families or they were not well, and continue with medical student training. And we needed to communicate remotely, share information, collaborate in real time 24/7. Huge challenge, not just for us, but for all the hospitals in the country. And the solution is we chat with the guys from Microsoft, and they were working with other hospitals in the country. They have developed what is called 365 Remote Assist, which is some kind of application that helps you to communicate. And the idea is, the challenge was we need to hands-free communication so that we can share the information in real time. We use Microsoft Teams to do this, and this was pretty safe because it was a 365 environment in our hospitals. We could share and record, operations or procedures on time. And what I'm going to do is to show you live exactly, and to encourage, stimulate other people to look outside the box and who we've been doing in Alderhay to use immersive technology. So this is basically the only part of the technology, how it works, and essentially is a hardware, which is the HoloLens, which is an augmented reality hardware, not virtual reality. And the HoloLens 2 is significantly more advanced than the HoloLens 1. And Remote Assist is the area in which you can communicate with each other using Teams. So in this one, first application was, can we do the work rounds remotely? So in a normal work round in a cardiac ward, you have 10 to 15 people, sometimes including a student, nursing students, doctors, etc. And we needed to reduce that contact. And in this way, we have one of our senior registrars using the HoloLens, and the rest of the consultants were remotely in offices or in their home following the work round. And the holograms or the floating images that you can see in any immersive technology type of mixed reality were produced using the EPR, the X-rays or the CT scans floating in front of our colleague, so that he can have the information in front of him. So it makes life a lot easier from that point of view. We have a...
Hello, how are you? Yes.
So this is a video in which he's going to see one of our patients, and obviously it's pixelated, and we can see in the laptop, in the right, in the lower part of the screen, all the things that our registrar can see is like being inside his eyes and inside his ear. So that was the first step that we did. I said, wow, right, so we actually can communicate absolutely live. We can see what he can see live, and the sound and the video was perfectly all right. So the next thing is, you know, there is patients who really need advice, especially from senior consultants or experts to registrars or senior house officers, who in the middle of the night, they need some support to do scans. And this is one of our registrars doing an echocardiogram in the middle of the night in a patient potentially with COVID-19, and we needed to have remote access. So it's having complete recording of that.
Carry on. Yeah.
And as you can see, the person wearing the HoloLens can see the screen of the video, and this currently can be transmitted via Bluetooth to the HoloLens. But this is a way that you can, in a very easy way, so exactly. But more important is how can you guide the other doctor in where to put the probe, so to acquire the exact images that you want. And I think that that's the beauty of the big difference of having a live using mixed reality, in which you can guide the other person exactly what you want to do. So that's when he's a remote expert. We developed some questionnaires in order to, like a little survey, to see exactly, because it's very important to measure if your technology is working or not working, and the people will welcome it. And we did, these are some of the questions that we did, and all were very positive, despite that was a very the beginning of the implementation of this. And once again, this is a vision. This is, we are in the process of trying to see if we can implement it even more. But once again, I think that, and I'm very convinced of that, whenever we implement a new technology, we should be able to measure what's the outcome of that from the clinical point of view, for the patients, if they're improving or not, for the families and the staff as well. This is another case, so in which we have a very, very sick baby in intensive care on the ECMO machine, and we needed to make decisions about changing some part of the management. And this is again in the middle of the night, and one of our consultant cardiologists doing an echocardiogram live using HoloLens, and the rest of the surgical team and the teams were either at home or in their offices to make decisions about what to do. And I received the call on my iPhone, and I was at home, and I could see exactly the movement of the heart, in which he's doing a live echo from the screen. And I can see exactly what I needed, which is the ventricular function of the heart. But at the same time, he can show me the rest of the screen, of the patient, of the screen on the monitor, etc. So it's like being there, and this make us help by massive decisions about these patients who change the outcome in a positive way. The next thing is the challenge is, right, can we use this with PPE? Because in the middle of the COVID, although being a children's hospital, we don't have, or we did have at the time, but hopefully we don't know if we are going to have the same amount of patients coming with COVID, adult patients. But certainly we have very much empathy for many, many hospitals who are absolutely drowned in patients with COVID. The use of PPE is important. So it was tried, and it's definitely, you can use the whole PPE using HoloLens, which they can be cleaned in a very simple way from person to person if you want to share it. Next thing is it's important to visualize, especially in very complex cases, to visualize the human anatomy or the heart anatomy in order to make decisions. And in this case, what we're trying to do is to overlay the images of a CT scan and MRI when they're doing a catheter intervention. And this is the team of cardiologists. So the team of cardiologists in the catheter lab, but this can be used in any setting, of course, in radiology, in adult site, in the vascular settings, in neuroradiology, etc. But it's just to show the processes. One of them is using the HoloLens, and we are remotely in another part of the catheter offices, looking at exactly what he can see in the holograms in the bottom part. And he's going to move the images of the holograms, which is trying to overimpose that on top of the heart to be able to stand, in this case, the ductus arteriosus in a baby who is ductal dependent circulation. And this is advanced visualization. This is put in a complete different level in which you have precision medicine on how to place the stent, not anymore in a 2D view, which is normally the view that any intervention will see in a screen, because with the HoloLens, you will have able to manipulate that in a 3-dimensional view. And again, this can be shared remotely, and we tested with a hospital, with one of our expert colleagues who was in America, and that worked really well. So it's different ways in which you can apply this, and not only during the crisis, but then you can apply this for the rest of your career. The next group was, which is my specialty, is cardiac surgery. We have so many babies with heart problems born during that period, and it was incredibly busy. And we have, as I mentioned before, 1 or 2 babies were born, and probably in some point they were infected with COVID, and we needed to have life operations, life-saving operations, otherwise they will not survive. And we're trying to reduce that. The reason I put this camera is because there is good things and bad things. One thing is, in my specialty, we have to use loops, you have to use lights, headlights, etc. And that's not compatible with the HoloLens at the moment. However, probably 80% of surgical specialties, they don't need to use that. And certainly in the medical area, non-surgical, they don't need to use loops, therefore it's possible. With a normal lens or glasses, that's absolutely fine to use HoloLens. But it's important to put that into context. So in this case, it's slightly long, but I'm going to show you the setting where we were doing the case, and in the screen in the right, in the bottom part of the screen, you will see the communication or the view from the HoloLens to one of our colleagues that we were needed to discuss the case. So here is one of our normal cardiac theaters in which we are proceeding to a baby, which is, I think that was 2.5 kilo baby with a nasty malformation called transposition of the great arteries. And we found something very unusual in the anatomy, and we needed to share with the rest of the team to make decisions about how we are going to change the operation or modify slightly the operation to do that. So my colleague was using HoloLens from the top of the bed and communicating, as you can see, with his fingers, communicating with one of our colleagues, so that all of them in a multidisciplinary team will be able to access exactly what we can see live without needing to come to the theater.
So aorta, PA at the back. This is a branch of the RV branch. We saw that was the LED, but the LED is here, next to that blue thing, which is coming to the apex, coming from this side.
So that's the view from the HoloLens in the screen in the right hand side.
The LED coming from the other side.
Yeah.
Which is intramyocardial. So it's just one side. And this is.
Can you see well, Mike? The other one that you just shown.
I was going to show you the original device. I think probably on the right. Then the right. Here, behind the LED, you see that white thing? Yeah. That's the whole thing going on the back. No, the blue.
Yeah, so you're gonna well, obviously you have to fix the 2 buttons. Yeah. Yeah. Thanks, Rafa.
Thanks.
You agree, Mike? Oh? Happy? Yeah.
So as you can see, you can communicate and they can hear you all the time. And the size of the hearts are tiny, so it's as always we're trying to compare it, probably the size of a big strawberry. And therefore it's incredibly important to have all this live communication in order to have the right decisions and save life. This brings you to the next step. It is clear, like, it's not just for communication. I think that the next level, and that was the most exciting part, is advanced visualization and precision medicine. And you know, you can overlay now holograms, and we are in one of the most tricky specialty, because the heart obviously moves. But if we are in any other specialty in which the heart doesn't move, or the organ that you're looking for doesn't move, etc., it probably will be easy. At the moment, there is different technologies that obviously accommodate that, but this is the idea of trying to put it in your head and communicate, and using everything together in order to communicate remotely with experts and sharing all that information in order to make decisions. So I think that the future is unbelievably exciting in order to use this technology. This is the current level of detail that MRIs or high-tech MRIs can give you. And these are real pictures of a human. And I think that that's what in a few years, probably that will be the norm. And when you think about as a surgeon or as a doctor treating a person, this will give you an absolutely tremendous detail, so to make your decisions for anything. I'm not talking about just heart problems, but you know, lung problems, cancer, tumors, etc. And the idea of having that in front of you as a hologram with many other things that you can share, it will make the way that we deliver healthcare or treatments in a very different way. For example, this is a way in which you can kind of holoportate or travel inside the heart in order to make decisions how you're going to repair the heart inside in a small baby, in where there is holes and we need to make tunnels, etc. And that's the idea, to having this in front of you and then wrap at the time of an operation. This is not futuristic, this can be done, and I think that it's just, let's think about it, that these are the first steps, and this can progress even more in the future. So what are the benefits so far? I think that each person that, or each group that uses is bringing more and more ideas of how to use it. And for us, we need to try to be more at the beginning, trying to see exactly, because you can get too excited, what things are we achieving what we wanted. And it definitely can reduce the number of staff needed in an operating theater or on a war round. So once again, the war round in our cardiac intensive care can encompass between 10 to 15 people. But if only one of them were the HoloLens traveling around between patients and showing you exactly what you will see if you were there, it's absolutely a bonus, and that can be done. That will translate in which obviously we reduce risk of cross-infection or acquired infection, hospital-acquired infection for the patients. So this it have a massive impact now during the pandemic, I think. For you to be able to consult with colleagues, not anymore just next to you in your hospital, but anywhere in the country or in the world, it's just tremendous. So if I have a complicated cases, which you see only one every 2 or 3 years, and you know somebody, I don't know, in Norway or in Australia or in New York, you can communicate with them, show them live, and so on. So I think that there is significant advantage for completely opening up or democratizing, if you want, the knowledge and share the knowledge between all professionals. One of the key things is that you can communicate free, because at the beginning you first thing that you say, well, what about if I walk around with my iPhone doing FaceTime or WhatsApp or doing that with an iPad, etc. But you have to carry them, or you can put it in a different display. But the big difference is 2 things. One, that obviously your hands are free. You can still communicate, and you can have floating holograms. What I mean, another piece of information in front of you, like probably more than 8 to 10. So I can have the EPR open, the X-ray open, the bronchoscopy open, etc., to make decisions. So the outcomes is that we can consult remotely, or the number of staff needed to be in the hospitals or in contact between each other will be reduced. We'll reduce the use of PPE, or we can reduce that. And obviously fewer specialists need to be in the work rounds, making them more efficient, maybe more efficient. We all know that in a work round, sometimes it takes for a long time because it's not, there is too much conversations around or distractions from phone calls, texts, etc. This is absolutely focused, and everybody have learned on doing remote MDTs are probably more efficient than live MDTs. Clearly, you can record and take photograph for all these, and it's safe from the GDR-free point of view because it's a hospital environment. And it's up to each one of us to see in which area you would like to use it. What are the downsides? The downside is, you know, medicine or healthcare is a touchy, you know, profession. So we really need to examine patients, or most of the time. We feel that we need to be in touch with other doctors and nurses and with patients, and it's nothing like being human-to-human interaction. But now this is go down to the face-to-face interaction or communication is reduced, obviously. But sometimes I think about it. I mean, it's not the way that we are living now. It's not the way that probably most people sometimes meet by a screen or talk by a screen rather than face-to-face. And I think that we just need to adapt where we are living at the moment. Is not perfect. It's just something else that we can use in order to carry on providing good healthcare. Sorry, this is just a quote that they asked me to say. I needed to show because it is important to say that in our case it's just a tiny heart, and be able to communicate with other colleagues is so important. Finally, we have a duty to educate and train, and that's the way that the information or the knowledge passed from generation to generation, and that's how I learn, and that's how our students will learn. And at the moment, it's a huge impact in education and training. Either medical students, nursing students, physiotherapy students cannot come probably to the hospital in the way that they used to come. Parents are not there, or the relatives are not there to give you the whole story or medical examination. And there is different ways that this can help to have remote access. The team, we were working with a team in Imperial College who have proactively trying to organize remote work rounds for their students. And a group of us interested in this around the UK, we've been working in that to implement it for different universities. This completely democratized, I think, the fact that you can provide to medical students a remote work round using immersive technologies when they are somewhere. And they don't need to be from your local university, it could be from somewhere else. If the expertise is, I don't know, in Cardiff about some type of spine problems, then a person from Aberdeen can benefit from that. And these are two videos from that we did in Alder Hey in our hospital from two technology companies who have developed this. And essentially it's to learn anatomy. So we just plant the skeleton in the middle of that corridor, and you can play with that. So you can acquire this from the company. So they are already developing. But you can imagine the amount of time that required to do this, to create these digital images. There's no doubt that they will be incredibly helpful for any students because they can all learn from remotely with the instructor in a different place. You can have clinical scenarios like this lady who we just put it in the bed. Again, it's from a digital model, which is simulating to having a heart attack. So you have the holograms of the ECG. So sorry, make it disappear and come back of the ECG. And it's all incredibly real for that. So I think that all this is tremendous work from technology companies from all around the world in which they can develop all this. For me, it's very clear. So in the 21st century, in the same way that everything is happening, people want to learn anytime, anywhere. We do that all the time. So we are probably sitting in our office or in the coffee shop, and we are Googling something and learning something. And it's anytime, so it's not prescriptive to a certain hour. And it's the same for the students. So I think that the current generation and the future, they will learn anytime, anywhere. And if we are smart, I think that we will be able to, they will probably be able to acquire a lot more knowledge that I did when I was a medical student. And hopefully they will apply in the right way. So I think that this is an exciting opportunity to use that. This is just a vision of how I think that things are going to go in the future. There's no doubt that in the north of England, or in many countries in which the geographic area are enormous with the population spread out, you need to try to provide the same quality of care as in the urban areas. And sometimes that's not possible. And for me, one of the weapons that we can use is using technology to close the gap of healthcare inequality, not just in this country, but in many other countries. The Royal College of Surgeons has been absolutely influential to spread knowledge and technology around the world, and this could be another opportunity to do it. Thank you, and any questions, welcome.